Can you hear me now? How's that? There we go. All right. How cool is that? It's working. I love it. Thanks, Dave, and Todd, and Katie, and Claire, and everybody else who's here from AppFee and Michael J. Fox Foundation for this opportunity to share an intimate patient visit with this lovely couple and 300 of our closest friends. Really appreciate that opportunity. Welcome into the clinic room. Most of our clinic rooms are not this large, I want you to know. Now, I know this couple. I've known them and been blessed to know them for a very long period of time. But we're going to try and take you back in time. We're going to sort of review what their history is and has been, and discuss how has Parkinson's affected them. And then near the end of my section, our section, we're going to do a dedicated movement disorder exam. It's not going to be complete, but it will be focused on the areas that most of us in movement disorders are interested in. And then at the end, as Dave mentioned, he'll come up and we'll talk about what happened here. So, just so that you know, all of our clinic visits usually start with a hug. So, excuse me. Great to see you. I'll hug you later. Okay, now, we've got to change the seating just a teeny bit, because if I can't see you like this, it's not going to be right. Okay, so here we are in this completely private setting, and we're going to talk about your lives. And if you could share with me, Shelly, what I want to do first is ask you a question about when did you notice, and Tom, I'll ask you the same question, but when did you notice that something wasn't right with your body? Something was wrong.
Well, it was probably...
Yeah.
It was actually, well before I was diagnosed. Actually, I was seeing a orthopedic surgeon for a nerve impingement in my right shoulder, and I said to him after getting many injections, "When do you think my shaking is going to stop?" And he said, "What do you mean?" And I showed him my tremor, and he said, "Whoa, that doesn't have anything to do with nerve impingement." And I said, "Well, what do you think it is?" And he said, "Well, I think you've got Parkinson's, but you're so young." And the first thing I said was, "Well, how old's Michael J. Fox?" And he's like, "Good point."
How old were you at that point?
47.
Okay.
48.
Okay. And so what did you do next?
I went to a neurologist, and basically after all the scans and tests and everything, he said, "You have Parkinson's, and there's really not a lot you can do about it."
Wow. How did that make you feel?
I walked out of the office just pretty numb. I certainly didn't expect to hear that. No literature, gave me some prescriptions and said, "I'll see you back, I think, in 4 weeks." Really no encouragement or heart and soul or anything, nothing. Nothing warm about it.
So.
And I was by myself.
Yes, right. And so how did that play out once you got home, or the next time did you call Tom?
I did, but I didn't think I called him until I went home.
Okay.
He was still working.
Yeah.
He's like, "No, you don't have it."
Okay, Tom, what, just think back. How many years ago was this now?
The official diagnosis was 2007.
But so that 2007 was when you talked to your orthopedic surgeon?
2006.
2006, and you saw the neurologist? 2006,
Yeah.
2007, okay. So think back with me. Was it kind of like, no, that's not, Shelly, that's impossible?
No, it was like, I could, for a number of years, she had the same symptom. Let it go. Progression towards the mean. It's all going to go back to normal. Everything's going to be fine. But no, she had to persist. And then she had the diagnosis that she had Parkinson's disease. Now that hurts. Let me step outside the fourth wall. Who else is a caregiver here? It hurts when your loved one is diagnosed with something like that, right? So denial, I think, was the first. Obviously, at that point on, denial was the first step. Then after that is what is going to happen to her? What's going to happen to the loved one? What will be my role? I mean, I'll do whatever I can do, but am I going to have to cut her food? Am I going to have to carry her, move her, wipe things? You know, really, you don't know what you're going to have to do. Learning curve. Yeah. You know, so my learning curve went way up. Wow.
Wow. Okay, so at the very beginning, it was kind of like shock and disbelief and denial, and then this feeling of, oh my gosh, she's got this disease. And you did say though, Tom, you said it had been going on for a while. How long do you think you had that shaking?
The shaking had been a while, but early things started. We know at least when he got his PhD, which was in '97 or '8, we know that date just because of this party that I had. And people that we had just met wondered why I always held my arm close and why my leg drugged and different things, which we noticed a while before that. We were downtown one day walking, and he said, "Why do you always carry your arm up?"
And we looked at her shadow.
We laughed, and I said, "I don't know," and we tried to make it swing, and he said, "Does it hurt?" I said, "No." And we just laughed about it, didn't think anything was wrong. So things were like that for a while.
So literally, 1997, that's 17 years ago. So you weren't swinging your arm, you're kind of dragging your foot.
And my writing got really tiny.
You're right-handed,
Right.
so your handwriting got small. The term we use for that is called micrographia. And so, is there any reason why you didn't seek out any type of...
I didn't think anything was wrong.
So really, it's just kind of like, well, I'm just getting a little bit older.
I didn't even
I'm
think
37.
Yeah, good math. You know, I just thought maybe one foot was bigger. That's when my foot drug. I threw away a bunch of shoes. I mean, I didn't really, neither of us thought anything was wrong. We actually kind of laughed
Wow.
about it. So.
Okay, and you didn't have tremor back then either.
The trauma came just a few years after that.
Okay. Note to Dave, we need to talk about the insidious nature of this. This is a great discussion point. So, okay, so there you are, 1997 up to 2007. You're getting some stuff done on your shoulder. You have a tremor. You go to see a neurologist. They basically tell you you've got Parkinson's disease. Okay, what next steps? I mean, he gave you some prescriptions. Did you take the drugs?
I did, and they made me tired and sick, and I quit them. And probably 6 or 8 weeks into it, my mother had signed me up for a video about Parkinson's or DVD, and I watched it at my lunch hour. And she called me and she said, "You have to get in with this doctor in Toledo, Dr. Elmer. He's a movement disorder specialist." And I still wasn't really sure that I had it. And I called, and actually they put him on the phone, and I saw him the next day, and
That's very rare, by the way. I just want to point out.
those were the old days.
No. I saw her the next day. Oh my gosh. I'm glad this thing isn't being recorded on. So how long was that after you had seen that other neurologist that we met?
Within months.
Months.
Yeah.
Okay. So then what did we do? What was? And I'm not here to blow my horn or anything. And you know, I give like 99% of the credit to our team. But what was the feeling when you left our visit? You know, what? Go.
It was a really great feeling. The gloom and I mean, I never.
Did you see the nurse practitioner first?
No.
Did you?
Well, yeah, I did see her for a short time, and then.
I mean, during that very first visit, did she?
No, I saw you.
Okay.
I'm right to the top.
Yeah, right. So go ahead. Sorry.
No, so we start talking, and you had me do some of these things, which I didn't really the other doctor had done a couple of them. We did a lot, and then you were asking me some general questions, and then things started. I said, well, one thing I've noticed when I go to grab for something, my hand doesn't go there, and the whole time. And then at the end, you encouraged me to go to a support group, and kind of like Barb and Dave said, I'm not in support groups. What do you have to compare it to? Have you ever been to one? No. I have no desire to hear everybody's problems and how many drugs they're on. And, you know, and he said, this group is different. They drink. So, yeah, I have a drink before we go to meetings. No, it wasn't like, it was a great group, and one of the facilitators, one of the leaders, he said, well, there's a woman here that's one of the leaders. Can I bring her in? I said, sure. And I, of course, recognized her because she's from the same town I'm in, and she was older than me, but not out of high school. But I recognized her because her genes were so strong, and she put me at ease right away. Her and her husband came in and talked, and started a support group meeting, and they were not anything like I thought they were going to be.
Yeah.
So.
And they partied a little bit, so that's good. Yeah, that's that group. You all have a lot of notoriety, let me tell you. So, but in a good way. Okay, so all right, and then when did we first meet?
Oh man, well, I'm not sure. It was one of those meetings I was asked to attend between you two, or
the symposium?
One of the symposium. Yeah.
Okay, all right.
And
So,
then, of course, all the fundraising things.
okay, did you? So Shelly came home. So you felt better? Is that fair to say?
I was relieved it wasn't something worse.
Okay, good. And did we talk about treating it?
Yes.
And we got you on something?
Yes.
Okay. And did you do okay with that?
Yeah, I did actually pretty well.
Okay. And then what did you tell him? What was the communication after?
It was tough because he said, there's nothing wrong with you. The guy doesn't know what he's talking about. There's nothing wrong with you. You're getting older. And so he was sort of blew it up for a really long time.
Okay.
Until I found that they drink at their readings. I didn't want to go to them because I had liquor on my breath. Little did I know that.
So once you knew that, then it was that's good. So maybe that's the key to starting a successful support group, is make sure there's lots of alcohol. I'm not sure I'm recommending that, folks, so dang, Michael J. Fox and Appy, please don't kick me off. Don't kick me off. Okay. So now let's fast forward. So we got you started on some medicines. How much better did you get?
My tremor was essentially gone within months.
Okay.
My leg wasn't dragging. I made major improvements in very short time.
Okay. Handwriting?
Handwriting has been the last thing to improve.
Okay.
It's gotten better.
So arm swing?
Arm swing's fine.
Okay. All right. So, and then, did you ever feel like, for example, Matt, who was up here earlier, mentioned there were times when he felt like he didn't really have Parkinson's. Have you ever had that?
I did, because I would watch other people, and even though you're never supposed to compare yourself, everybody progresses differently. I thought I really don't have it. So I stopped my meds, and I saw Dr. Elmer at a caregivers meeting, and I kind of pulled him aside and told him, he said, I open my mouth, stuff just comes out. He thinks before he opens his mouth. And he said, okay, why did you stop? And I said, because I didn't think I had it. And he said, and I said, I think I have it. He said, you have it, don't do that again. And then it wasn't like I was in denial. I just didn't understand why I was doing so much better.
That's fine. And the nice thing is that you weren't in a position, there used to be a time actually when we would do drug holidays. That was many, many years ago when I was younger and dinosaurs roamed the earth, and we used to think that was a good thing to do, to take people off meds. We don't think that's a very good idea anymore. So, but some people, especially in the early stages, they do go off them, and then they see that the medicine really is doing something, and then that's it's at least helpful. So, but then you were pretty stable, if I remember correctly, with regard to your symptoms. You weren't experiencing a lot of the ups and downs that people describe. But recently your insurance changed.
Yes.
And you had to go on a short-acting form of one of the dopamine agonists. So just for our audience, there are three major groups of medications: levodopa, which is the most common one, carbidopa, levodopa; dopamine agonists, which include drugs. They go by the names Requip, Mirapex, Nupro, Ropinirole, Pramipexole, Rotigotine, those are the generics. And then there are drugs called MAOB inhibitors, that's selegiline and rasagiline for us old folks, Aldopril and Aslac. So, and then there's stuff called Comtan and Sleevo. So there's a whole bunch of medicines that we use, but you were on a dopamine agonist, if I remember correctly, a long-acting one, and then because of the insurance issue, you had to go on a short-acting one. And what happened with that?
It was like going backwards. It was frustrating. I found myself not going out because I just couldn't rely on the way I walked. My leg was dragging. My arm was up. People would say, "What's wrong with your legs? Why do you walk like that?" I mean, people that didn't know I had Parkinson's. It changed a lot. It changed my thoughts.
And that was part of the social dynamic, if you will, too. Explaining to people what's wrong with you, what you have, that you have this disease. You know, like when we went to party one time, everybody kind of knew that the shaking, that Shelly had been diagnosed, except for one guy came to the party late. He used to call her, now this is kind of glib, but he used to call her Shaky J. And he comes to the party and he says, "Hey, Shaky J," and she says, "Tony, I've actually been diagnosed with Parkinson's."
It was like an EF commercial. Everybody went.
Yeah, jaws dropped, and then it opened up conversation. It really kind of broke the ice, and everybody was able to talk about it, and that was a huge support group.
Well, it's sensitive for
everybody
everybody, but it's not sensitive for me. I mean, it doesn't bother me at all to talk about it, but and he'll do things now. People will do things now. I'll knock on wood, and he'll say, "Did you need it really knocked that many times?" You know, so we can make it.
Okay, so I guess what I'm trying to get at is that there was a change in your medication. With that change in medication, you used the term, you went back in time, your symptoms reappeared, and then did you experience the so-called fluctuations, the on-off, where it worked for a certain period of time and then would quit working?
Yeah.
Okay. And recently you've been able to go back on the long-acting and
feel great.
feel great. So good. Okay. What about, let's talk a little bit about premotor symptoms. These are things that, you know, there's a lot of interest in symptoms of Parkinson's that exist before Parkinson's really exists. The typical motor symptoms, stiffness, slowness, shakiness, loss of sense of smell, changes in bowel habits, maybe lightheadedness, maybe talking or moving around in your sleep. Did you have any change in your sense of smell at all?
I did not.
Not at all.
Not
So,
at all.
and I think I talked to you all earlier, and you've talked in your sleep since way back. So, yeah, probably. And that's probably not related, because the changes that we're seeing in Parkinson's are things that develop after we're adults. They're not for people, because my daughter slept walk when she was younger, and so she might do something like that. Okay, and then, but no lightheadedness, no change in your bladder, no changes in sweating patterns, nothing that you noticed that was really, since you've had Parkinson's, have you noticed anything, like for example, cold? Some people have trouble, regulating their body temperature. And sleep, have you had trouble sleep?
I've had maybe trouble sleeping.
Yeah, tell me about that.
I would just not be able to go to sleep. And Tom's like, if you just lay there long enough, you'll go to sleep. And
Yeah.
I tried a couple different sleeping things and nothing worked. So,
Yeah.
But I can function on 3 hours of sleep
Yeah.
really fine.
Yeah. Now, I know we talked about this, and I think I asked your permission to talk about this, but if I didn't, I'll have to ask your forgiveness later on. But there was a time when I think I was pushing your medicine a little bit too hard, and you have always been a type A, AAA plus, I've never met anyone who's more active and has more stuff going on than you, and yet, I think, Tom, we talked on the phone, and it was kind of like, she never stops, and you were exercising, like you had I think you had like -5% body fat. You were so lean, and you were cleaning the house like into 3 o'clock in the morning. Am I remembering this correctly?
Yeah, and yeah. When Shelly doesn't sleep, she makes sure nobody else does either. But sometimes it would be just like, we're out, let's go do something. Well, it's 11 o'clock. Where do people our age go? They're in bed. She went, go. And our daughters noticed it too. And she was just driving me crazy. And as caregivers, we care about that and want to do the best we can. So I called the social worker at the hospital. I said, we need to intervene. Now she still holds this against me, but it's one of the best things we've ever done to at least take a look at regulating those medications. And to this day, I can tell when she's not taking them on time and when she is. But it speaks to the effectiveness of the drugs too. They work. Maybe too well in this case, but we pared it back.
Right. So just so our audience knows that again, different medications can do this, but I think in your case it was one of the dopamine agonists, and we have discovered that possibly 15% of people who are on that class of medicine can have something called impulse control disorder. So basically, there's that impulsiveness or that compulsiveness. You just have to do something. And some of them are pleasure-seeking. The ones that have been dangerous have been like gambling, sexual activity, overeating. But I think in you, it was more the cleaning, organizing, exercising.
I would never know the next day where the towels were. She moved them overnight.
It's hard enough for us husbands when our wives move anything in the house. It's like you walk in and you sit down and the chair's been moved and you find yourself on the floor. We're creatures of habit, I think. So, okay, so we got through that challenge, and you're still working.
Yeah.
And so, hasn't affected your work at all, really?
No, everybody there is sensitive. The owners of the company made a wellness room for me and put a massage table in. We're getting massages and put a flat screen TV and got a lazy boy so you don't feel all the way down. So they've made a bigger deal about it than me.
Can I work there?
And I hate the word disease because
Right.
people will say, well, you're sick. I'm not sick. Well, you have a disease. Well, I don't consider that sick, but so a lot of people have used the term. I don't use it, but everybody's very sensitive about it, but I've been fine with it, so.
Okay, all right. So now, let me ask you, what's your attitude now, and how are you feeling, Tom, about this?
Well, I'm not crazy about it, but I think we're lucky. We've noticed the progress slowly. It's progressed slowly. We've made a lot of new friends. I've learned a lot about the disease. I remember when I was learning about movement disorders. I'm on the computer. What is dyskinesia? What are tremors? And in fact, and the phone rings, and it's the guys from the Parkinson's group who want us to go shoot skeet. And this is probably not. How many guys are going? People are going 4. How many went last time? 8. We're talking about. I don't know if I want to be around these people. But let me say another doctor friend of ours there, and he says, the Parkinson's.
We're all loading our guns.
Yeah, but again, you don't know. The effectiveness of the drugs. Another occasion, we just remodeled our house, and then to save money, I did the painting. But I can walk in a room, I can see a professional did this or not because you cut in the edges. And Shelly says, I can cut in those edges. I'm thinking again, this is not something you typically associate with somebody has a movement disorder, but she did because of the effectiveness of the drugs. And I know some of this is kind of levity, but on the other hand, Larry, I've noticed times that we've been out for dinner, for example, and it's so frustrating. I can't cut my food. And you look at your loved one, and you get sad and you go, yeah, well, maybe this is the next step. But we do what we do, we gladly do what we do. And then maybe it's time to take your medicine. She's got all these bird noises that go off on her cell phone and all these alerts. So I think that with the proper physician care and the drugs, sometimes you don't even notice it. Unless you're a caretaker, you have it, and it's constantly on your mind. And it wears on me. Answer your question.
Yeah, and I think that's what I was getting at is, and do you feel, I mean, how has this affected your relationship? You guys have been married for how long now?
32 years.
32 years, and you've been dealing with this diagnosis now for 7 years. So do you think it's changed the relationship?
It's deepened it. I mean, it would progress naturally anyway, I would think, but that there's something even more special about your loved one, a negative thing, but it maybe endears you a little bit more. I don't know. It's too early to tell. She's like Matt says. I think she's one of the luckier ones, because of the slower progression, and because of the medicine, and because of her excellent doctor and support. So, don't know.
If you had one thing to share with people who are newly diagnosed with Parkinson's, what would be your message to them?
To make it a priority to find a movement disorder specialist. For me, it was like night and day. It was the difference between gloom and doom. I mean, when I met Dr. Elmer, he could have been a horrible doctor. The drugs may not even work, but they did. But he was so informative. His whole entire staff. You walk in there, you feel like you're their favorite patient. They're all versed. They all know what's going on with other patients, and that means a great deal. And it has a lot to do with your attitudes. Attitudes are everything, as you know. And when you have somebody that's that devoted in the staff, it makes all the difference.
Well, thank you for that. That's kind of the overarching message of this conference, and since you and I had not rehearsed that, I'm very, very grateful you feel that way, and I think those of us who do this business feel very strongly about it as well. It's what we live our life for, is to make Parkinson's disease as insignificant as possible in the lives of people and their families who are doing it. So, can we do the brief exam?
Yeah.
Is that okay? All right. Let's go ahead and just turn just a little bit. All right. Great. Okay, so just relax. Okay, follow my finger with your eyes. Keep your head still. Smile for me. Stick out your tongue. Good. Shrug your shoulders. Good. Arms up like this. Real strong. Push out. Good. Fingers up straight like this. Strong. Strong. Squeeze my fingers. Fingers. Good. This leg straight up. Real strong. This one. Good. Toes up. Excellent. Good. Okay, now take your right hand and go like that. As big and fast as you can. Okay, now the left side. Good. Right hand, open and close, big and fast as you can. Keep up with me. Go, 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 go. Go, 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 go. Go, 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 go. Okay, left side. Yeah, a little faster, huh? Okay, good. And now right hand over under. Excellent. Left side. Okay, good. And now just relax. Just relax. Open and close your left hand for me. Good. Relax. Open and close the right hand. Good. Okay. And what we're doing here is we're checking for something called rigidity. stiffness in the joints, which is related to the lack of dopamine. And when we check either the wrist or the elbow or the knee, we're looking to see if there's any superimposed stiffness, and it comes not from the bones themselves, but the muscles aren't as fluid in their movement, which is actually not the muscles problem, but the dopamine problem. And Shelly actually has virtually no rigidity. So now, I know you had something done to your back recently, so I don't want you to do this if you don't feel comfortable, but normally we would have you stand. Okay, good. And you have to cross your arms and stand up. Good. Okay, put your arms at your side. Okay, come out here. And I just want to make sure you're very careful. Don't fall off the stage. That would be something I would do typically. So if you can, just walk down to the end of the stage. Turn around and come back. Okay, turn around. And so normally, yeah, there you go. So normally, one of the things we do, spread your feet apart a little bit. One of the things that we do, which is a very, very important test, because Parkinson's can affect your balance. Now that said, there is so much we can do for balance problems. And I have to tell you that not all doctors, I think, because in the old days we used to say there wasn't anything you could do for balance problems. But there is a lot you can do. It's just that we can't correct balance problems in everybody. And one of the things that we do in the exam setting is we will pull people back, and I'm not going to do it to Shelly right now because I don't want to hurt her back, but we pull hard enough that then they have to take at least 1 or 2 steps back. It's the term for it is retropulsive challenge. Retro meaning back, pulsive is a force. So it's a force backwards, and if you can get your balance back in 2 steps, you're good to go. That's completely normal. So let's see. I think that's. Yeah, no. It's okay. I just don't. In fact, I'll tell you what. Tom, why don't you come up here? I'll at least show him. Yeah, there we go. Yeah. Okay. It's bigger than I am. Okay, here we go. Okay, so first one's practice. Okay, good. Now, a little bit stronger. Here we go. Ready? Excellent. Good. One more time now. Ready? Very good. Okay, you pass. You pass. Okay, give him a hand for that. Yeah. So, Dave, help me. Am I missing anything grossly? I mean, I think we've covered most of what we wanted to cover. So, we talked about premotor, non-motor, progression over time, the results of the medications, here, make something. Yeah. Yeah. Right. Oh, yeah. That's the other thing. Thank you. So, what about studies? Have you been you've been able to participate in clinical trials? Yeah. So, tell me, how did you feel about that?
Well, initially, I was thinking clinical trials were like the lab rats, and I got educated, and I did my first one probably within the first year of seeing you.
Okay.
And that was
Wasn't that drug that made you deathly ill? Oh my gosh, she was such a sport. Everybody else was doing great, but her stomach, for some reason, just couldn't take it. So.
And Dr. Elmer said, we've got to take you off this. You're getting too thin. And I said, oh, you could never be too rich or too thin.
Did you all hear that? You could never be too rich or too thin? Oh my gosh.
There were three different
classes or doses, yeah.
And a placebo. And
yeah.
I got sick after my very first pill, and I said, if I find out on the placebo when this is done, I'm done. And I was on the highest.
The highest dose, which they eventually decided was too high. Yeah. So,
and she fell asleep a lot. Anywhere, out, just out.
Okay. Is that the only study that you've done another one since then?
I did one for low blood pressure.
Okay.
And
Yeah.
I did one for.
So anyway, how do you feel? How do you feel about studies?
I feel good. I wish more people get involved. I don't know if the percentage is still 1% or less still get involved in drug trials, and they're what we need to find more drugs and better
Well,
drugs.
I'll tell you, the Michael J. Fox Foundation is working hard to change those numbers. So anyway, well, thank you both so much for sharing your lives with me in so many ways, but also sharing them with our audience. So Dave, bring us home, buddy.
So what we want to do now is talk a little bit about what took place during this session, and we want to take your questions as well. So if